Melasma is also known as scholasma. Coming to the epidemiology of melasma, it is an extremely common problem. Occurs mostly in the age group of 30 to 50 years. Affects females mostly in a predilection of 10:1. The main etiology of melasma includes estrogen, which includes the oral contraceptive pills and the hormonal surges in pregnancy, and sunlight, particularly the ultraviolet B light, which is predominant between the timings of 10 a.m. to 4 p.m. The sites of predilection of melasma include the forehead, the centrofacial region, which includes the malar areas, the nose, and the upper lip. It can also involve the mandibular area, which is the area of the chin. The clinical features of melasma include presence of brown macular pigmentation with a well-defined scalloped margin. The pigmentation of melasma darkens on sun exposure. These are the clinical pictures of melasma patients that show the brown macules with scalloped borders present over the malar area, and you can also see the pigmentation involving the upper lip. Another picture of a patient with melasma showing the involvement of the cheek, the nasal bridge, slight areas of the nasolabial folds, and the upper lip. This patient also has involvement of the forehead. Now coming to the treatment of melasma. Photoprotection is the mainstay of treatment. Avoidance of sun, if it can be done strictly. Wearing hats, broad brimmed, or using an umbrella whenever you go out. And sunscreens. Now we'll talk about the sunscreens. The sunscreens that we commonly give to our patients are chemical sunscreens, which means that there are certain chemicals in the medicine which get deactivated when the sunlight falls on them. So these need to be applied 30 minutes before the sun exposure. Since there is chemical deactivation by the ultraviolet light, we need to reapply the sunscreen every 2 hours if you are continuing to be in sunlight. A schedule of 9 a.m., 12 p.m. and 3 p.m. is usually preferred in most of our patients. The sunscreens that cricketers and sports people use, which appear extremely white on the face, are known as physical sunscreens, and they have zinc oxide and titanium dioxide in them. They block the UV light by physical barrier and hence don't need any reapplication. The medical treatment of melasma includes hydroquinone, which is used in a concentration of 2 to 4%, may be used alone, or it is used in combination with a retinoic acid and a topical steroid. The combination of a hydroquinone, a retinoic acid and a topical steroid is known as the Klingman's regimen. Azelaic acid also forms a part of the treatment of melasma. It is given topically as a 10 to 20% cream, and efficacy in various studies has found comparable results to hydroquinone. Other agents that may be used in melasma include topical glycolic acid creams in a concentration of 6 to 12% and kojic acid and arbutin in a concentration of 1 to 4%. Another modality of treatment of melasma is chemical peeling. First, we'll try to see what all chemical peels we can use. Glycolic acid chemical peel is the most important chemical peel in the treatment of melasma. Variably can be used from a concentration of 50 to 70%. Another peel that is really effective in patients with melasma is a trichloroacetic acid peel. It is used in a very low concentration of 15 to 30%. What we do in a chemical peeling is these medications are applied on the affected areas and we wait for the termination of action of peels, which we see by the area turning slightly red, which is known as erythema, or there may be a frost, which is slightly white color. And then we terminate the action of peels either by a neutralizer, such as a sodium carbonate, or there are certain peels that self-terminate themselves. So we can just use water post a chemical peel. The picture on the right shows a patient before and after a session of chemical peel. We can see that the brown scalloped pigmentation, macular pigmentation of melasma has significantly decreased even after a first session. What happens post a chemical peel is the affected cells with pigmentation are shed off, as a result of which it stimulates the fresh skin from below to take its place and appears much clearer than the initial picture.